I'm Rajika Reed. This video will focus on what birth control is and how it works. Birth control, or contraception, is the deliberate use of an artificial method or other technique to prevent pregnancy as a consequence of sexual intercourse. It is important to note that although birth control prevents pregnancy, it does not always protect against sexually transmitted diseases. So let's start by looking at how it works. This is a diagram of the female anatomy. Eggs are produced in the ovaries, and when released, they travel down the fallopian tubes to implant in the uterus. The next diagram shows the path sperm travels to reach the egg. As you can see, the sperm enters the vagina, moves through the cervix into the uterus, and then down the fallopian tube to find the egg. Once it fertilizes the egg, it moves into the uterus to implant and grow. Effective methods of contraception either act as a physical barrier to prevent the sperm from coming into contact with the egg, or use chemicals such as hormones to alter the environment so fertilization cannot occur upon contact. This chart gives a quick overview of the different methods of birth control. As you can see, the methods listed on the top of the page are most effective, and as the methods go down the page, they're less effective. The ones on the top are most effective also because there's less room for human error. But let's talk about hormonal birth control methods first. There are two different kinds, the barrier and the hormonal. So let's work with hormonal first. The birth control pill is the most commonly used hormonal contraception. It contains synthetic estrogen and progesterone in pill form to be taken daily. Similar to the pill is the shot, only given once every 3 months. Both the patch and the vaginal ring are also prescription hormonal methods. The patch, like a Band-Aid, is a small, square adhesive worn on the skin to release hormones through the skin. The vaginal ring is a flexible ring that a woman inserts in the vagina to release hormones in the vagina. Next, we move on to the male condom. This is one of the best known and most widely used methods of birth control, although still not used enough. Condoms are a barrier method of birth control as it covers the penis and catches the sperm after a man ejaculates. Both male and female condoms can be purchased at drugstores and do not require a prescription. The female condom is a lubricated polyurethane sheath. It is inserted into the vagina. The closed end covers the cervix. Like the male condom, it is intended for one-time use and then discarded. It's inserted before intercourse and acts as a barrier method by preventing sperm from reaching the uterus. The diaphragm is a prescription method that you have to be fitted for. It fits inside the vagina and covers the cervix. It functions by physically blocking the sperm, and the spermicide also kills the sperm. As you can see, there are many different sizes, and I'd also like to point out that they don't have holes in the middle like these do. These are just samples that are used for teaching. Similar to the diaphragm is the cervical cap. It is a small, thin latex or plastic dome-shaped device, smaller than a diaphragm. It is designed to fit completely over the cervix. A healthcare professional will need to fit you for it after a pelvic exam. Spermicide is placed on the outer rim of the cap and in the portion of the cap facing the vagina. The cervical cap prevents pregnancy by blocking the sperm from entering the uterus. This, too, is a barrier method of birth control. The sponge can be bought without a prescription and is a donut-shaped device made of soft foam that is coated with spermicide. The spermicide kills sperm upon contact. Glad we're all awake. That was just an overview of options available. So, in summary, what we've talked about today, there are many different birth control options available to women, to young women, and many of them need to be discussed with your healthcare provider. But there are some options you can purchase and try for yourself. And we divided birth control options into two major groups: barrier methods and hormonal methods. Under barrier methods, we have male condoms, which I realize are not the responsibility so much as a woman, but female condom, which women do have control over, and the diaphragm, which, just to remind you, you need to be fitted for. The cervical cap, also a device you need to be fitted for. And the sponge, something you can buy over the counter at a local drugstore. Under the hormonal methods, you have the birth control pill, which is a prescription. The shot, also a prescription. The patch, which is also a prescription. And the ring, also a prescription. It's important to note that in this group of options, the male condom, female condom, and the sponge are the only ones that you don't need to have a physician write a script for. And out of those, the male condom and the female condom are the only ones that actually protect you against sexually transmitted diseases as well. The good news is that you have lots of great options to discuss with your provider. The other news is that 99% of sperm fail. But the 1% that don't, they're really good at what they do. So good luck!